right in, Ethan. Microbial infections, such a fundamental topic, but one that forms the basis of understanding, well, everything in nursing practice when it comes to patient care. Think about how these microbes sneak into the body through portals like the respiratory tract, the gastrointestinal tract, even skin wounds. It's like they've got a detailed map.
Absolutely, Yenna. These entry points are pivotal. For instance, take the respiratory tract. Pathogens like the influenza virus attach to epithelial cells lining the airways, beginning with processes like adhesion and colonization. The virus uses its surface proteins to lock onto human cells, practically hijacking our machinery. This kind of understanding is key in nursing for identifying airborne transmission risks.
Right? And what's scary is how fast these little invaders multiply. It's not just about infection, it's the havoc they create on a cellular level. They release exotoxins and endotoxins, targeting healthy cells. You've got things like streptolysin O, boom! It destroys red blood cells, chemical warfare inside the body.
Yes, and that brings us to immune evasion strategies. Many bacteria deploy mechanisms to hide from or disable the immune response, like producing biofilms or altering surface proteins. A great example of this progression is sepsis, a condition we sadly see far too often in hospitals.
Oh, sepsis, yes. Let's talk about that for a moment because identifying its early triggers can be life-saving. Fever, confusion, tachycardia, classic systemic signs. But did you know patients can have localized signs too, like purulent discharge? Recognizing these quickly is everything.
Exactly. A nurse's vigilance in patient monitoring is invaluable. For instance, elevated white cell counts or organ-specific dysfunction in lab results are red flags. One case I recall involved a post-surgical patient whose subtle changes in vitals, just a spike in heart rate, turned out to be early signs of septic shock.
And that's why training the eye to pick up on the smallest clinical cues is so important, right? You might not see the whole picture at first, but each symptom is like a puzzle piece screaming out for intervention.
Absolutely, Yenna. It's a reminder that our role isn't just reactive, but proactive, ensuring that care happens before the infection gains the upper hand. And as we'll explore further, this is where antimicrobial therapy steps in, tailored to specific pathogens and the site of infection.
Speaking of proactive measures, Ethan, let's dive into what truly fascinates every nursing student: antibacterial drugs. These little lifesavers are, well, the cornerstone of modern medicine.
Absolutely, Yenna. Let's begin with the major classes of antibacterial drugs. Of course, the beta-lactams are an important group. These include penicillins, cephalosporins, and carbapenems, which all work by disrupting bacterial cell walls. Take penicillin, for example. It binds to penicillin-binding proteins and inhibits bacterial cell wall synthesis, causing the bacteria to, quite literally, break apart.
Ah, the classic penicillin. And it's still so relevant, like how it's widely used for streptococcal infections. Whatever else we discover, penicillin remains a game changer, right?
No doubt about it. But then we've got narrow spectrum versus broad spectrum antibiotics. And this is where understanding bacterial coverage really matters. Narrow spectrum drugs, like the older penicillins, target fewer bacteria, while broad spectrum ones, like amoxicillin, cast a much wider net. The trick is choosing the right one to avoid promoting resistance.
Which brings us to resistance. The bane of healthcare. Enzymatic inactivation, for example. Some bacteria produce beta-lactamases, enzymes that destroy the beta-lactam ring. Suddenly, that wonder drug, completely useless.
Exactly. And that's why we pair beta-lactams with inhibitors like clevelinate. A combo like Augmentin neutralizes those enzymes and restores efficacy. It's these smart combinations that make all the difference in practice.
Right. But we need more than just clever drug combos. Nurses play a massive role here. educating patients to complete their antibiotic course is critical. I always tell my students, stopping halfway gives bacteria a chance to regroup and develop resistance, becoming even tougher to treat.
And it's not just individual habits. On a bigger scale, hospitals have implemented antimicrobial stewardship programs to evaluate and refine prescription practices. I remember a facility where we tracked antibiotic resistance trends and adjusted policies. It was astonishing how much resistance rates dropped after just a few targeted interventions.
Incredible. It just proves that evidence-based practices really work. And when we understand resistance mechanisms, mutations, efflux pumps, biofilms, it helps nurses anticipate challenges and adjust treatments. We're literally at the front line of keeping antibiotics effective. Speaking of tools in our fight against infectious diseases, let's talk about vaccines. What a marvel of science! They've completely reshaped how we protect populations and complement antibiotics by preventing infections in the first place. Let's break this down, Ethan. 3 main types: whole pathogen subunit and nucleic acid vaccines. Each has its strengths, right?
Absolutely. Whole pathogen vaccines are the veterans, you could say. They use either weakened or inactivated versions of a virus, like the measles or polio vaccines. These are incredibly effective, though they require careful storage to maintain potency.
And then we've got subunit vaccines. My favorite to teach about. These are like, hey, here's just the antigen, no messing around with the whole microbe. They're great for people who might have weaker immune systems. Examples? Oh, the pertussis vaccine, a game changer for reducing whooping cough, especially in infants.
Exactly. Subunit vaccines also include conjugate and recombinant protein types. And let's not forget nucleic acid vaccines, like the mRNA vaccines used for COVID-19. These represent some of the most exciting advancements in vaccine technology, giving us a way to program our bodies to fight specific pathogens. They're quick to develop and highly adaptable.
So cutting edge. And as nurses, we not only administer these, but also educate. Patients trust us to explain schedules, side effects, the importance of boosters, everything. One missed dose can put protection at risk.
Right, and vaccines aren't just about individuals, they're about communities. Herd immunity only works if enough people are vaccinated. And speaking of community, let's talk about combating COVID-19 with antiviral drugs. The options have expanded so much,
Oh, totally. We're talking fusion inhibitors like Camostat for entry prevention, polymerase inhibitors like remdesivir targeting viral replication, and protease inhibitors like Paxlovid slowing down enzyme action. Each has unique protocols and nursing considerations, like timing those doses and anticipating reactions like fever or fatigue.
Exactly. It's also critical to monitor for serious side effects, like allergic reactions with monoclonal antibodies. Nurses are central in early intervention when these issues arise, ensuring patient safety at every step.
And that brings us to antimicrobial stewardship. Resistance isn't going away unless we fight it on all fronts: hospital policies, patient education, consistent drug reviews. Ethan, why is this so vital?
Because without stewardship, we're essentially sidelining ourselves in the fight against infections. Resistance rates soar when antibiotics are overused or poorly prescribed. It's more than just prescribing appropriately. It's about reviewing local resistance data and ensuring the shortest effective treatment duration. Nurses can directly influence this by advocating for best practices and ensuring patients understand their roles in preventing resistance.
Exactly. It's all about working smarter. Keep educating ourselves, look out for evolving guidelines, and collaborate with the whole healthcare team. Nursing isn't just a job, it's a commitment to staying ahead for the patients and for global health.
Well said, Yenna. And with the growing complexities of infectious diseases, our roles as nurses have never been more crucial. It's about blending compassion with science to provide the best care possible.
On that inspiring note, we've reached the end of today's episode. Remember, knowledge is power, and in nursing, it's also a lifesaver. Thanks for tuning in.
Yes, thank you for joining us. Take care and stay curious. We'll see you next time.